Your waist measurement is telling a story about your health that your bathroom scale cannot see. Right now, regardless of what the number on the scale says, the distribution of fat around your midsection is determining your risk of heart disease, stroke, type 2 diabetes, certain cancers, and premature death with far more accuracy than your total body weight ever could. You could be within the normal weight range, according to BMI charts, and still be at significant health risk if your waist circumference is elevated. Conversely, you could be classified as overweight by those same charts, but have minimal health risk if your waist measurement is in the healthy range. What this means is that millions of people are focusing on the wrong metric. They are stepping on scales, tracking their weight obsessively, feeling discouraged when the number does not move, while completely ignoring the measurement that actually predicts whether they will develop the diseases that kill most people in the developed world. The critical distinction is between subcutaneous fat, which sits just under the skin and is relatively harmless, and visceral fat, which accumulates around your internal organs and drives metabolic dysfunction, inflammation, and disease. Your waist circumference is a proxy measure for visceral fat. Your total body weight is not. This is why waist size predicts lifespan and health outcomes far more accurately than weight or BMI. And it is why understanding and monitoring your waist measurement should be a higher priority than tracking your weight. Hi, I am Dr. Alex. I am an emergency medicine doctor, and after nearly 10 years working in A&E, I have treated thousands of patients with obesity-related conditions. What has become strikingly clear is that body weight alone tells you very little about metabolic health. I have seen patients who are technically obese according to BMI but have excellent metabolic markers, normal blood pressure, normal cholesterol, and no sign of insulin resistance. I have also seen patients who are normal weight or only slightly overweight but who are metabolically unhealthy, with high blood pressure, elevated blood sugar, fatty liver disease, and significant cardiovascular risk. The difference between these two groups is almost always visceral fat distribution. The metabolically healthy obese individuals carry their weight in subcutaneous fat, primarily in the hips and thighs. The metabolically unhealthy normal weight individuals carry their weight as visceral fat around their organs. When you understand this distinction, it changes how you think about health, weight loss, and disease prevention. My goal is to help you understand why waist circumference matters more than weight and what you can do about it. Now, before we continue, I want to make you a promise. I am going to give you the most thorough, evidence-based explanation of why visceral fat is so dangerous and why waist measurement is the metric you should be monitoring. Everything I share is based on current medical research, not diet industry marketing or weight loss trends. What I ask in return is simple. If you want to understand what actually determines your health risk rather than chasing arbitrary weight goals, hit the subscribe button right now. This channel is dedicated to giving you information that your doctor probably does not have time to explain in a 10-minute appointment. If you watch this entire video and you have not learned something genuinely important, you can unsubscribe. No hard feelings. But if you give me your attention, I will give you everything I have learned from over a decade in medicine about protecting your metabolic health. So please, subscribe now to help this channel reach more people who need this information. Let us talk about why waist size matters so much. To understand why waist circumference predicts health outcomes better than weight, you need to understand where fat is stored in the body and what different types of fat actually do. Fat tissue is not a passive storage depot. It is an active endocrine organ that produces hormones, inflammatory molecules, and signaling proteins that affect metabolism throughout your body. But different fat deposits have very different metabolic effects. Subcutaneous fat is the fat you can pinch. It sits just beneath the skin, primarily in the hips, thighs, buttocks, and arms. This fat is relatively metabolically inert. It stores energy, provides insulation, and produces some hormones, particularly leptin, which regulates appetite and energy balance. But subcutaneous fat does not significantly increase disease risk. In fact, some research suggests that lower body subcutaneous fat may actually be protective against metabolic disease. People who carry their weight in their hips and thighs, the so-called pear shape, tend to have better metabolic health than people who carry weight in their abdomen, even when total body weight is the same. Visceral fat is completely different. This fat accumulates deep in your abdomen, surrounding your liver, pancreas, intestines, and other organs. You cannot pinch visceral fat. You cannot see it directly, but you can estimate how much you have by measuring your waist circumference. Visceral fat is metabolically active in ways that are profoundly harmful. It produces inflammatory cytokines, including interleukin 6 and tumor necrosis factor alpha, which drives systemic inflammation throughout the body. It releases free fatty acids directly into the portal vein that goes to your liver, which causes fatty liver disease and hepatic insulin resistance. It produces hormones that interfere with insulin signaling, leading to insulin resistance in muscle and fat tissue. It secretes proteins that increase blood pressure and promote blood clotting, and it creates an inflammatory environment that accelerates atherosclerosis, the buildup of plaques in your arteries that cause heart attacks and strokes. All of these effects are dose-dependent. The more visceral fat you have, the worse the metabolic consequences. This is why waist circumference, which correlates strongly with visceral fat volume, is such a powerful predictor of disease risk. Studies published in the Journal of the American College of Cardiology demonstrate that waist circumference predicts cardiovascular events, including heart attacks and strokes, independently of BMI. This means that even among people with the same body weight, those with larger waist measurements have significantly higher risk. Research in The Lancet shows that waist circumference is a better predictor of type 2 diabetes risk than BMI. For every 5 centimeter increase in waist circumference, diabetes risk increases by approximately 34% in men and 42% in women, regardless of total body weight. Similar patterns hold for cancer risk. A study of over 40,000 participants published in the British Journal of Cancer found that waist circumference was associated with increased risk of several cancers, including colorectal, pancreatic, and postmenopausal breast cancer, even after adjusting for BMI. The reason is that visceral fat creates an inflammatory, insulin-resistant state that promotes cancer cell growth and survival. Now, here is what makes this particularly important. You can have a normal or even low BMI and still have excessive visceral fat. This condition is called normal weight obesity or metabolically obese normal weight. These individuals have low muscle mass and high body fat percentage, with the fat concentrated viscerally. They look thin or normal weight. They are not concerned about their weight, and their doctors may not identify them as at risk. But metabolically, they are in serious danger. They have the same insulin resistance, inflammation, and cardiovascular risk as someone who is clinically obese. Studies show that normal weight individuals with central obesity, defined by elevated waist circumference, have higher mortality risk than obese individuals with normal waist circumference. This is the critical insight. Distribution matters more than total amount. Where your fat is located determines your health risk far more than how much fat you have overall. The mistake that most people make is fixating on weight as the primary health metric while ignoring waist circumference entirely. They step on the scale daily, they track every fluctuation, and they judge their health and their success based on that number. But the scale cannot distinguish between muscle and fat, between subcutaneous and visceral fat, or between health promoting weight loss and muscle loss that actually worsens metabolic health. Someone can lose significant weight through extreme calorie restriction or excessive cardio and still have elevated waist circumference because they have lost muscle mass but not visceral fat. They are lighter, but not healthier. Their metabolic risk has not improved meaningfully because the dangerous fat is still there. Conversely, someone can gain weight through resistance training and improved nutrition while simultaneously reducing waist circumference by losing visceral fat and building muscle. They are heavier on the scale, but dramatically healthier metabolically. Their cardiovascular risk has decreased, their insulin sensitivity has improved, and their inflammation has dropped. The scale would tell you they failed. The waist measurement would tell you they succeeded. This is why weight alone is such a poor metric. The second mistake is not understanding what constitutes a healthy waist circumference. The clinical thresholds are well established but rarely communicated effectively. For men, waist circumference should be below 94 centimeters, or approximately 37 inches for low risk. Above 94 centimeters indicates increased risk, and above 102 centimeters, or 40 inches, indicates substantially increased risk. For women, waist circumference should be below 80 centimeters, or approximately 31.5 inches, for low risk. Above 80 centimeters indicates increased risk, and above 88 centimeters, or approximately 35 inches, indicates substantially increased risk. These thresholds vary slightly by ethnicity, with some populations showing increased risk at lower measurements. But the principle remains the same. If your waist circumference is above these thresholds, you are at elevated risk for metabolic disease regardless of what the scale says. The third mistake is measuring waist circumference incorrectly. Most people measure at the wrong location or measure over clothing, which gives inaccurate results. The correct method is to measure at the level of your navel, or more precisely, at the midpoint between the bottom of your ribcage and the top of your hip bone, with the tape measure horizontal around your body. The measurement should be taken at the end of a normal breath, not while holding your breath or sucking in your stomach. The tape should be snug but not compressing the skin. This measurement, done correctly, gives you the most accurate estimate of visceral fat accumulation. The fourth mistake is not recognizing that you can be metabolically unhealthy at any weight. The focus on obesity as a disease state has obscured the fact that metabolic dysfunction occurs across the weight spectrum. Thin people can have insulin resistance, fatty liver disease, and high cardiovascular risk if they have visceral fat accumulation and low muscle mass. These individuals are often missed because they do not fit the stereotype of someone at metabolic risk. They are not screened appropriately, they do not receive interventions, and they progress to disease without ever realizing they were at risk. The fifth mistake is believing that weight loss alone, without attention to body composition, will solve metabolic problems. Losing weight through severe calorie restriction, liquid diets, or excessive cardiovascular exercise often results in loss of both fat and muscle. If the proportion of visceral fat lost is not substantial, metabolic health may improve only minimally despite significant weight reduction. This is why crash diets so often fail to produce lasting health improvements. The weight comes back, and when it does, it often comes back as fat, including visceral fat, while muscle mass is not recovered. The person ends up heavier and metabolically worse than before they started. So what should you do differently? The approach that actually works targets visceral fat specifically rather than total body weight. The first step is to measure your waist circumference correctly and use that as your primary metric for tracking progress. Weigh yourself if you want, but do not obsess over the number. Focus on waist measurement because that is what predicts your health outcomes. If your waist circumference is above the healthy threshold, your goal should be to reduce it to within the healthy range, regardless of what happens to your total body weight. The second step is resistance training at least 2 to 3 times per week. Resistance training builds muscle mass, which is metabolically protective. Muscle tissue is insulin sensitive, meaning it helps regulate blood sugar. It also burns calories at rest, which helps create the caloric deficit needed to lose fat. But most importantly for visceral fat reduction, resistance training appears to preferentially reduce visceral fat compared to subcutaneous fat. Studies published in Obesity show that people who engage in resistance training lose significantly more visceral fat than those who only do cardiovascular exercise, even when total weight loss is similar. This is because resistance training improves insulin sensitivity and reduces systemic inflammation, both of which help mobilize visceral fat stores. The third step is to prioritize protein intake to preserve and build muscle while losing fat. Aim for at least 1.2 to 1.6 grams of protein per kilogram of body weight daily. High protein intake supports muscle protein synthesis, increases satiety, and has a higher thermic effect than carbohydrates or fats, meaning your body burns more calories digesting it. Research shows that high-protein diets lead to greater loss of visceral fat and better preservation of lean mass during weight loss compared to lower protein approaches. The fourth step is to reduce refined carbohydrates and sugar, particularly fructose. As discussed in previous videos, excess dietary sugar drives visceral fat accumulation through de novo lipogenesis in the liver. Cutting out sugary drinks, reducing processed foods, and minimizing refined carbohydrates has been shown in multiple studies to specifically reduce visceral fat. A trial published in the American Journal of Clinical Nutrition found that reducing sugar intake led to significant reductions in liver fat and visceral fat within weeks, even without significant total weight loss. The fifth step is to incorporate regular cardiovascular exercise, but not as your sole form of activity. While resistance training should be the foundation, adding 2 to 3 sessions of moderate intensity cardio per week provides additional benefits for visceral fat reduction and cardiovascular health. Activities like brisk walking, cycling, or swimming for 30 to 45 minutes several times per week, combined with resistance training, produces better outcomes than either alone. The sixth step is to ensure adequate sleep. Sleep deprivation is strongly associated with visceral fat accumulation. Studies show that people who sleep less than 6 hours per night have significantly greater visceral fat compared to those who sleep 7 to 8 hours, even when controlling for diet and exercise. Poor sleep increases cortisol and disrupts appetite-regulating hormones, both of which promote visceral fat storage. Prioritizing 7 to 9 hours of quality sleep per night is essential for managing visceral fat. The seventh step is stress management. Chronic stress elevates cortisol, which directly promotes visceral fat deposition. Research demonstrates that people with high chronic stress levels accumulate more visceral fat over time compared to those with lower stress, independent of other factors. Implementing regular stress reduction practices, whether through meditation, yoga, deep breathing, or other methods, helps reduce cortisol and protects against visceral fat accumulation. The eighth step is monitoring your progress through waist measurement every 2 to 4 weeks. Do not measure daily because fluctuations from water retention, digestion, and other factors make daily measurements unreliable. But regular measurements allow you to track whether your interventions are working. If your waist circumference is decreasing, even if your weight is stable or increasing slightly, you are improving your metabolic health and reducing your disease risk. That is success. Let me bring this back to the clinical reality. In the emergency department, I do not see patients come in with complaints about their BMI. I see them come in with heart attacks, strokes, diabetic emergencies, and complications of obesity-related diseases. And when I review their medical history, almost universally, they have elevated waist circumference and central obesity. Their visceral fat has been driving metabolic dysfunction for years or decades, creating the conditions that led to the acute event that brought them to me. What is particularly tragic is that many of these patients had normal or near normal weight earlier in life and never considered themselves at significant health risk. They did not fit the image of someone who needed to worry about heart disease or diabetes. They were not told to measure their waist circumference or to focus on body composition rather than weight. By the time the disease manifested, years of visceral fat accumulation had already done its damage. The interventions I have outlined are not theoretical. They are evidence-based approaches that consistently reduce visceral fat, improve metabolic markers, and reduce disease risk when implemented properly. They work because they target the actual problem, which is visceral fat and metabolic dysfunction, rather than the proxy measure of total body weight. Here is the bigger picture. We have spent decades telling people that weight is what matters for health. We have created a culture of weight obsession where people judge themselves and others based on a number on a scale. We have medicalized obesity as a disease defined by BMI thresholds. And while there is truth to the idea that excessive body fat is unhealthy, the focus on weight has obscured the more important truth about fat distribution and metabolic health. The result is that people who are healthy despite being heavy are stigmatized and pressured to lose weight that their bodies do not need to lose. Meanwhile, people who are unhealthy despite being normal weight are reassured that they are fine and do not need to make changes. Both groups are being poorly served by a metric that does not actually predict health outcomes well. Waist circumference is not a perfect metric. It is a proxy measure that correlates with visceral fat but does not measure it directly. More sophisticated measures exist, including CT scans, MRI, and DEXA scans that can quantify visceral fat precisely. But these are expensive, not widely available, and not practical for routine monitoring. Waist circumference is simple, free, and provides enough information to guide decisions and track progress. What I want you to understand is that your health is not determined by your weight. It is determined by your metabolic function, your inflammation status, your insulin sensitivity, and your cardiovascular health. All of these are influenced far more by fat distribution than by total fat mass. Focusing on waist circumference rather than weight shifts your attention to what actually matters. It allows you to set realistic, health-focused goals. and it prevents the metabolic damage that comes from obsessive weight loss attempts that sacrifice muscle and health for a lower number on the scale. So here is what I need you to do. First, if you found this information valuable, please subscribe to this channel right now. I am dedicated to creating content that challenges conventional health wisdom when that wisdom is not supported by evidence. The fixation on weight rather than body composition is one of the most pervasive and damaging myths in health culture, and I will continue providing the science that allows you to make better decisions. Second, measure your waist circumference correctly using the method I described. Do it now, before you finish watching this video. Write down the measurement. If it is above the healthy threshold for your sex, you have work to do regardless of what your scale says. If it is within the healthy range, you are doing something right metabolically even if your weight is higher than you would like. Third, shift your focus from weight to waist circumference as your primary health metric. Stop stepping on the scale daily. Instead, measure your waist every 2 to 4 weeks and use that to evaluate whether your health interventions are working. Fourth, implement the interventions I outlined, starting with resistance training and protein intake. These two changes alone will produce measurable improvements in body composition and visceral fat reduction over several months. Finally, share this information. Most people have never been told that waist circumference matters more than weight. By spreading this knowledge, you help others escape the weight obsession trap and focus on what actually protects their health. Thank you for watching, and I will see you in the next video.